Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex, to self-love, to questions about body parts. Let's get this episode started. Alright, I'm going to be talking about intrauterine devices, or IUDs. Now, before we start, I want to cover just some basics about IUDs. First, there are actually two different major types of IUDs. There's copper, and then there's hormonal. So copper just has copper, and the hormonal has a type of hormone in it. So both IUDs are placed in the cervix through a procedure where you go to the doctor's office and you sit with your legs open, and they use a speculum to look inside your vagina. They then take the IUD and insert it into your cervix, and the end of it goes into your uterus, and that's where intrauterine device comes in. So IUDs. Now, this might seem like a lot for a little piece of birth control, but the benefit of IUDs is they last for a long time. So copper IUDs can last, technically they can last longer than 10 years. They last a long time. But the ones that are most commonly used in teenagers or people that have not ever had a baby are going to be smaller hormonal forms of IUDs. The smallest form is going to be one that only lasts for 3 years, and then they go all the way up to 6 years. But again, the smallest form is going to be 3 years. So you do that procedure, and then it stays in place for 3 years, and then you have it removed and start the process all over again, or try something else. Totally up to you. Now, because there's copper versus hormonal, the side effects are going to be different. Copper really won't have much of an impact on periods at all. There's no hormone in it, so it doesn't change your ovulation. In fact, some people experience a little bit of heavier flow when it's first placed, but that usually resolves within 6 months or so, and then it can stay in place for a long, long, long time. So that's the benefit of copper. And then the hormonal ones, it's a variety of impact on periods. Some people, it does stop their ovulation for a period of time. Most people do experience at least reduction of period blood flow and improvement of cramps. So regardless of if it changes your ovulation, which is the release of an egg from your ovaries, it still has positive benefits for your period. So hormonal IUDs. All right, question number 1. I have a hormonal IUD, and I was just wondering if I need to use condoms while I'm taking an antibiotic for my acne. The type of antibiotic that's usually prescribed for acne does not interfere with hormonal forms of birth control. In fact, the only antibiotic that can impact any form of birth control is going to be rifampin. So you really don't need to worry about the antibiotic changing the efficacy of your IUD. But condoms are the only way to prevent sexually transmitted infections. So you don't need to use a condom necessarily to improve the efficacy of your birth control, but you do need to use a condom if sexually transmitted infections are a concern. Okay. Question number 2. How many months after IUD implantation does spotting go away? So spotting, or bleeding between your periods, can happen. That's one of the side effects. It usually goes away within the first 6 months or so. So if it doesn't, talk to your doctor, but it should resolve in up to 6 months. Question number 3. Is it normal for my period to disappear completely for a year after getting an IUD put in? It can be, for sure. So specifically with the hormonal IUD, it's quite possible that it was placed and the hormone has changed your period cycle, which is, a lot of people like it, some people don't, but a lot of people enjoy not having a period. So one thing to know is that Usually after the levels of hormone come down a little bit over time, so over years, your period might return. Totally normal, totally fine. You're still covered as far as pregnancy if you are within the recommended time frame for that IUD, but it's possible that your period will return after the first year, but totally fine. Question number 4. I got an IUD and I don't get a period anymore, but I do get dark discharge about once a month. Is that my period, and is that normal? So it could be considered to be your period. Brown discharge is generally going to be some dried old blood from the lining of your uterus, and that's kind of like what a period is. It's not a big deal. I wouldn't be worried about it. It will probably, like the previous question, it will probably return to straight blood the further you go on with having your IUD, but for now it could be normal and totally fine. Question number 5. How often should I check for the strings of my IUD? I've checked once or twice before, and I've had it for up to a year now. But when I feel around for it, I only feel one string. Is that normal? Okay, so that's kind of a long question. How often do you check the strings, and is it normal to only feel one string? So it's usually recommended by your doctor to check the strings of your IUD about once a month, usually after your period. And you check by inserting your finger into your vagina and feeling for the strings. Again, that's usually about once a month and after your period. Now, if you only feel one string, I suspect the other one is probably in there because the string is actually one long string that's tied, knotted in the middle, anchored to that IUD. So if you can feel one string, it's okay. If you can't feel any string, then you need to talk to your doctor. But feeling one string might just mean that the other one's kind of stuck up in a crevice of your cervix. So it's still there. That'll do it for this round of IUD questions. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.